And we are live.
Welcome to the Creating Excellence, how to effectively eliminate self-sabotage to lead work life and elevate your energy to achieve your version of the desired success that you want. This is an interview series where we dive deep into the minds of high performing leaders and industry experts to unlock the strategies behind their success. Each episode offers you invaluable insights that you can apply to elevate your personal and your professional life. Be sure to check out the description box below for more details about today's guest. And don't forget to subscribe so you never miss out on the actionable tips and strategies from these experts. Also, you can access exclusive gifts and resources from our experts that will support you on your journey to excellence. Today, our guest is Mark Brezzel. How you doing,
Brezzel, yep.
Mark?
Good, good, good.
How you doing?
Hey,
I'm
Mom.
doing
So,
wonderful. Yes, this is
so
exciting. I'm always glad to talk about opportunities to improve lives.
yes, sir. So tell the audience a little bit about what you do. How do you support leaders in their journey?
Basically, just kind of give you a little bit of background, my background. I spent 10 years in cardiac surgery as a cardiovascular perfusionist. I transitioned into industry as a medical science liaison. And so I spent a lot of time within the biotech and now medical device industries where I interface with various clinicians and people all around the country. I had gained a great deal of experience in networking and trying to find out where the gaps of information lies. One of the things I just wrote a book sharing my testimony as a diabetic, because let me tell you, diabetes is not fun, but it is palatable and is manageable if you have if you handle this thing correctly and you have all the information in front of you. Many times, as African Americans, we are dramatically impacted in many ways, negatively. But a lot of that is because of lack of information and a lack of action. Because we have to be on top of this thing. We can't wait until we're not feeling well to go in and get our situation addressed. And so what I do is to help, you talked about self-sabotage, and I think that's all part of this thing when we do not bother to take our health into consideration. Many times, our bodies are like machines. And with a car, if you don't put the proper gas in there, if you don't change the oil, if you don't, change the tires, if you just let it run, eventually you're going to have some issues. And it's the same thing with our bodies. And so what I try to do is try to encourage people. I have eight key health principles that help you to be the premium specimen that you were created to be. And that's my focus. Everybody, it's not anything, it's no secret. It's nothing that costs you $1 million to attain. It's just being active. It's just being out there and taking advantage of these key principles, and it will help stabilize your life wherever you are. Again, when we talk about training, I was the first African American to graduate from Johns Hopkins School of Cardiovascular Perfusion Sciences back in a few years ago, and and so it was always a pleasure. I had an opportunity to meet one of my mentors. His name is Dr. Levi Watkins. He was actually the first African American surgeon to put in a heart defibrillator in a patient. And he was also one of the physicians for Dr. Martin Luther King. He was one of his doctors. When Dr. King was when he was the pastor down in Atlanta, he was his deacon. So they had a great relationship. He was really part of the whole civil rights movement. And he told me years ago, Mark, the reason why I'm telling you all this, he gave me a whole spiel of his background. I was just a wide-eyed kid just sitting in his office, this very decorated office, and he was telling me, I'm telling you all this not because I'm hyping myself up, but because you're first here and you have a legacy as well, and you have to always pay it forward and always let others know that they can achieve whatever they want to achieve, and also let them know that they have to keep pressing forward. We have to be very congruent and go about and telling other people of opportunities, and so that's what I'm here for. Not only sharing opportunities, but also helping us to be better people, because it's hard for us to be if we're sick, laid up in an operating room, or if we're laid up in a hospital on a ventilator, we can't really be effective, and we can't be good parents. We can't be good fathers, mothers when we're sick. Health is critical. Health is wealth. I've heard some people say, but health is premium, and there's ways that we could go about trying to maintain that.
Yeah, yeah, we're all about premium as well. Like we are we, but like anyone watching, if you're in the chat, like I want to become a premium person. Doesn't that sound great? Like, but and
Right.
it's crazy because that should be normalized, I believe. And
Right.
so
That's right.
what I know you said, but you've been a clinician,
Mm.
and shout out to you for all that you've done. And so this transition is like you must have been super motivated to really tackle like diabetes education. So could you tell us, like,
Yes.
in your view, like what are the most critical aspects that are often overlooked, and how can
Well,
we actually better, like, how can we better empower ourselves, like, or how could individuals better empower themselves living with diabetes or knowing someone that lives with diabetes to actually take control of their health so they can actually become that premium person?
what's interesting for me, you said something else key. I was extremely motivated. The
Mm.
reason why I'm extremely motivated is because I am a type 1 diabetic. I became a diabetic a year after I got married in 1999, in 2000. I actually diagnosed myself, and it was the most traumatic situation I could have ever been involved in. One, I just got married. Two, my wife was, we got pregnant later that year with our first child. And me being a clinician, I understood all of the complications, and I understood this trek that diabetes can create. And I'm
Mm.
thinking to myself, are you kidding me? And then you, of course, you go through the period of withdrawal. You go that period of frustration, the period of anger, and you get to a point where you have to come to grips. Okay, it is what it is. What am I going to do about it now? And so that's where I have to make that transition and mentally saying, okay, it's not a death sentence if I take care of myself. And that's what I want to encourage, the audience to understand. Some of the early signs, basically for me, as you have symptoms, your body will tell you if you are even in that pre-diabetic state. Some people will have an insatiable desire for sweets. An unnatural desire. I used to drink pop like it like it was water. I mean, and my wife would say, "Why are you drinking this stuff? Why you need to drink more water?" But it just was a desire. And then eventually that transitioned. You started feeling tired. I started to lose weight, and I couldn't understand why I was losing weight. I mean, I was trying to stay active. I was very active in my lifestyle. I used to ride a bike, and I biked a lot, but I wasn't really working out that hard to be losing the amount of weight that I was losing. And so that kind of was my first key. I said, I need to go get this looked into. But in the process of setting that up, then I started to have some of the others, hunger, a lot of just, weird hunger and just thirst, particularly thirst, where, I started drinking a lot. And that's probably why I was drinking all that pop. And then eventually it transitioned into frequent urination and all this kind of stuff. So those are some of the key signs that you want to look for. What I tell my audience, and what I tell patients, if something is not in the order, you are the only one that knows you the best. No doctor, no nurse, no therapist can tell you about you better than you. I mean, you will know things that little things that happen that are going on in your body, and you can even try to explain that to them. Many times they're looking through an algorithm, but you just say, hey, look, this is not right, or that's not right, and you let them know. And that's what happened with me. I met with colleagues and I said, okay, this is not right. And I went to the store, bought one of those over the counter urine tests, and it came back positive. And that's when I contacted my doctor, and I was just floored. I was decimated by it. But again, what I realized is that many of the issues that we have, particularly in our community, is timing. We don't get things checked out. We ignore symptoms. We throw us to the side saying, well, I'll get better, or I can overcome. And and instead of getting to the root cause of what's causing all the issues. With any disease process, the earlier, the better. You know, And so if you can get checked out soon, sooner rather than later, then you know what you're dealing with, and now you can start implement changes in your diet, being more active, making sure that you are when I talked about premium, having that premium lifestyle. I mean that there's 8 key health principles that I focus on. One is fresh air. Why do you need fresh air? Well, your body needs oxygen. It's oxygen is critical for everybody's system. So go out and enjoy fresh air. It comes with drinking good water. You got to drink. We have to. Do you realize that many cases of arthritis that people deal with later in life is because they didn't drink enough. They were dehydrated. They didn't drink enough when they were younger, and it causes damage around the sacs around your joints and so forth. And so even that can be warded off by just drinking enough water. But your body, you need water. You need fresh. You need sunshine that helps you balance your mental stress. If you're stressed out from work, if your boss says something that just totally drives you crazy, go for a walk. You've been amazed at walking. You don't have to pay monthly at a health food club, or you don't have to be Tony Atlas, or you don't have to be some big, strong. Walking is probably the most effective exercise that anybody could do. Walking 15, 20 minutes a day. Just walk, and you get fresh air. You get good oxygen. If you walk on a sunny day, you get sunshine. And walking will help you rest, which is another key component. You got to. A lot of us we're so stressed out, and we're so worried about trying to make a buck. We don't sleep like we should. Rest is critically important, because that is where your body is recuperating and your body is healing. If you're sick, or if you had a rough day, or if even any type of stress your body has endured, it tries to kind of reinvigorate itself during sleep. So if you don't get enough sleep, you're not giving your body enough chance to kind of recover from the days that you're exposed to. And of course, exercise. And the premium of all this, again, is diet. Many times we love to eat, but sometimes what we eat don't love us. And so we have to be careful that of the things that we put in our bodies. Again, the challenging thing for me as a clinician is people take better care of their cars than they do themselves. We tell them, you don't need to eat this, and you should cut back on that. Well, I have. You say that you have no ramifications. It is what it is. I'm going to die of something someday. Yes, that's true. We are, but you could definitely modify, and you could definitely increase your longevity by doing certain things. It's the same with your car. If you take zero care of your car, you can bank it that something's going to happen to it. And it's the same thing with us. And then finally, I call it temperance, where we try to moderate everything. In the United States, when we were in Greece, it was amazing to me how thin those people were over there. The good old Mediterranean diet, and their food was even different. United States, our foods are so laden with preservatives, and they're so fattening. Fat and preservatives are particularly for a diabetic are not your friend. Fat actually causes additional insulin resistance, and that has issues in and of itself. And for a diabetic, you want your insulin into your cells to reduce your overall glucose count, and also improve metabolism. But when your cells are bouncing back all of this insulin, now you have to overcompensate it, and all of these things will help with that. If you exercise regularly, that will help your insulin resistance. So even if you are diabetic, by doing these health principles and following these health laws, these principles, you'd be amazed at how it will increase your longevity. Because I think a lot of times we take so much for granted. We can't just stand in the corner and pout about our circumstance. We can do there's so much we can do to improve our situation, and particularly with diabetes and heart disease. Exercise, drinking water, good hydration, fresh air. You need that oxygen. All of these things helps your body stay in tip-top shape, and now you become more resistant to diseases and what you'll be exposed to, because now your immune system is better off, And so if you are exposed to things, your body is better able to fight things off. And so it's kind of reciprocal thing. And then the final thing, I call it, basically a trust in a higher source. Some people believe in God. Other people have something that they deem as that they have put their faith in. But the bottom line is that there's many times in situations where we don't have all the answers. So so many times you seek sources that can kind of give you a perspective that you may not have, and that helps you in the long run with all of these other key health principles. And now that allows your body to operate on a higher level. So now you're more resistant to stress. You're more resistant to disease. You're more resistant to many of the challenges that we face in this very fast-paced society we live in.
Yeah.
Yes. This is such a powerful talk. And first of all, I do want to commend you, being a man. A lot of times, men, you worked in the medical field, so I can see why you are definitely leading this. But a lot of men, they don't want to go to the doctor, or,
Nope.
So I really want to commend you for leading,
Yes.
in this area, and then also sharing
Yes.
your story and supporting people.
Mhm.
How can people get in contact with you? And also, please share the gift that you want to give the audience.
Well, one of the things that I was, as far as my I have a website, and I'll send all this information. You can just go to my website; it has all of my contact information on there. I am open to come. I'm willing to speak with you one on one. Reach out to me. I'll be happy to talk to you individually. If you have an event that you want me to come and speak at, I'll be happy to do that. I am so motivated to reverse, I call it the curse of these chronic diseases. We're African Americans are number one in heart disease. We're up there in diabetes. We're the highest demographic that gets amputations of your legs because of many times of poor circulation and peripheral vascular disease. And that doesn't have to be. A lot of times is because we ignore symptoms, and like you just said, many of us feel that we can conquer our own circumstances, and we don't need help. We go pull ourselves out of our situation, but sometimes you're not going to be able to pull yourself out of your situation. Go to the doctor, get checked out, and and then once you have an idea of what you're dealing with, now you could put together a strategy on how you can stay on top of this thing. But particularly for amputations, majority of that is particularly is lack of information. Many times, particularly for type 2 diabetes, they have the highest risk of peripheral vascular disease. Why? Because they're uncontrolled. Many times they only show up to the doctor because they're sick, they're having problems, and then they find out their blood sugar's been 3, 4, 500 for 3, 4, 5 months, and that causes a spiraling effect in your bodies. And that's why I said before, I am almost 60 years old. I was diagnosed when I was 30. I don't have any issues. Every time I go to the eye doctor, they tell me that my retina is very strong. There's no signs of diabetic retinopathy. And I have my ups and downs, of course. But if you try to do what you can do, if you try to eat right, if you try to get at least some walking in, some exercise in, some fresh air, some sunshine, to balance your system, that really really pushes a lot of these other issues further down the road. I know people that have died of old age, not because of diabetes. So it's not a death sentence.
Yes, more life, more life.
Life. I love living.
Exactly, exactly. And I want to correct you on that one. 70, 60 years young.
There you go.
There we go.
Thank you. I appreciate that. Yes, 60. It's interesting. A lot of times people say, you don't look 60. Well, I'm not 60 yet. I'm like 58. I'm about to turn 59. But even with that, I just try to live a life, and I try to encourage people. Don't throw in the towel. Take care of yourself. That's not a very difficult thing to do. Sometimes our mindset is where we want to, our history and our cultures many times predisposes us to doing certain things. But the fact of the matter is that everything we do is a choice, and you have to choose to do better. You have to choose. I'm not going out like this, and that was basically my focus. I have a family, I have a wife, I have 3 grown children. I can't go out like that. I don't want to be in a wheelchair. I don't want to be on dialysis. I want to be intricately involved in their lives and my grandchildren's lives. And
About that legacy. It's all about
that's
that
right.
legacy.
That's
Yes.
right.
Yeah, this is so powerful. I really hope that you are really hearing, what Mark is talking about. If you are on their journey and you have diabetes, or you just have you have something going on, and you really want his motivation. You want to be educated. He was a medical clinician for so long in cardiology realm. So make sure you go ahead and check out the description below. You can have access to connecting deeper with Mark. And,
Mhm.
thank you so much for tuning in to another episode of Creating Excellence. Please share the key takeaways and insights and valuable nuggets that you learned from Mark here today that stood out to you. Share your thoughts in the comments, and we'd love to hear your perspectives. Don't
Yeah.
forget to click that subscribe button so you can stay up to date with the latest expert interview. You can click the notify me button also to receive a reminder for when we go live in these interviews, and you can actually ask questions in real time. Every expert in this series has gifted you an incredible resource and tools to support you on our gifts page. So definitely check the description box so you can get access to not only Mark's gifts, but every other expert on this interview series. So check the description box below. And remember, achieving excellence starts with aligning your goals, your time, and your energy. And we're here to guide you in every step of the way. We will see you in the next interview.
Yeah.